Hey everybody, talking a little bit more about does your patient need a second opinion for subungual exostosis? Typically what I'd say is if your conservative treatments are failing or you've been seeing patients for several weeks or several visits and they're not responding to that treatment, then that may be an indication just to get that second opinion. And it may not be for a surgical opinion, it's just for some of those advanced conservative or non-surgical options that we may be able to put into place. But of course, we'll talk about some of those surgical options, make sure that we've got that diagnosis correct, and then go from there. But if your patient is in a high level of pain on that initial visit, definitely consider making sure that we've got our diagnosis right, but whether they may be appropriate for that second opinion sooner. If they're having impact of their activities of daily living or their sporting or work activities, because it is a really simple, minimally invasive procedure that I undertake, there's a really good option just to say, okay, let's jump through, let's get that second opinion sooner so that we can say exactly what the problem is and how we're going to fix that, giving the patient all of the information. If your patient's indicating on an x-ray that there's quite a large subungual exostosis, it's less likely to be treated effectively through conservative therapy. And this is where you may consider that early referral for the second opinion and potential surgical management. But if all else fails and your patient's wondering, okay, what further do I need to know about surgery? Is it an option for me? That's where I'm here to provide them with some of that information. Getting a second opinion, can really help clarify in the mind of our patients about, okay, well, here's all of our non-surgical options that we can undertake and what ones are appropriate for that patient. And then, going on to, okay, well, here's the surgical options and this is the potential recovery. This is what we're going to be looking at moving forward as well. And so, giving that peace of mind and all the information to our patients is a really good way. But if you're finding any further information that you're wanting, check out some of our videos. If you've liked what you're seeing, hit the subscribe button and we'll see you in the next session. Cheers.